Hey everyone, welcome back to Heart Health with Michelle. Today we're going to talk about menopause and nutrition. I'm going to give you a brief overview of the importance of how what we're eating during this menopausal transition is imperative for your bone health, your heart health, insulin resistance, your body fat distribution, all of the things that often change during the menopausal transition. For those of you who don't know me, welcome. Hi, my name is Michelle Rothenstein. I'm a cardiovascular dietitian, and my mission is to help you reduce your risk of heart attack, strokes, and heart related complications using science based nutrition that's metric driven. So, there's a lot of angles I can talk about menopause, and I love talking about this topic from so many different standpoints because a lot of things are shifting during the menopausal transition. I'm on the medical advisory committee of the National Menopause Foundation for the last 2 years, and I love bringing the importance of recognizing these shifts and how we need to address heart health given the risk of heart disease substantially increases during this transition of time. I want to really talk about just a couple of elements here. I've done many lectures on bone health and menopause and heart health and how that's connected. I've done many lectures on gut microbiome shifts that happen during menopause and how nutrition is connected. But I want to keep this nice, short, and sweet. And I dive deeper into this in my Optimized Group program. If you are interested in learning more about that, head over to my website, entirelynourished.com. I want to talk about something that doesn't really get talked about and oftentimes goes underneath the radar. And this is the fact that many times during menopause, because we have that decline in estrogen, our blood vessels become more stiff because estrogen allowed our arteries to be more elastic and allow for better blood flow. So many times women have an increase in blood pressure and they may not even recognize it because they go to the doctor, they're anxious, they're blaming it on white coat syndrome, and they never test it again. But if we ignore that high blood pressure, that can actually cause progression of atherosclerosis. That can cause heart failure and cause aortic aneurysms and AFib. So it's important that we are actually testing it. So if you're in the menopausal transition or you're in menopause, my best advice for you today is get a blood pressure cuff at home, test your blood pressure, and really target it to less than 120 over 80. Now, you may say to me, well, Michelle, if I am having these decreases in estrogen and, I'm going through menopause and these are all changes are happening, why don't I just go on hormone replacement therapy and then I'm free of cardiovascular disease risk? Well, hold on a second. We have to recognize that hormone replacement therapy can really help with many symptoms of menopause and can work in certain individuals, but it needs to be a personalized approach. That's one. And then we also have to recognize that that alone is not the solution. We have to be shifting what we're doing to help our body with these hormonal shifts. So, as much as our arteries get more stiff because of a loss of estrogen, well, what can we do to increase it? So, one pathway that really has an effect is the nitric oxide pathway. And this is kind of a complicated pathway because it's not just like, okay, eat nitric oxide rich foods like your beets, your arugula, your kale, and you'll be okay. Your body has to make nitric oxide. And the way it does that is actually through your gut microbiome. And so, if you don't have a gut microbiome that has a lot of good bacteria in it, it isn't able to convert that into nitric oxide. So it's super important that we are really focusing on your gut health as when we're going through menopause, there's a lot of shifts in our gut microbiome, microbiota, so to speak. And if we now are focusing in on nutrient adequacy, so adding in a wide variety of our nutrients that support gut health from our indoles to our DMB to our butyrate producing foods. So think much like our complex carbs, our whole grains, our legumes, our fruits, our vegetables in the right quantities and in the right pairings, we can help. But we also need to focus in on that good bacteria from a variety of probiotics that confer a lot of anti inflammatory benefit as well. So we have to be looking at your gut health in the picture of this. And we also have to be looking at your metrics to assess what's shifting. So many things are shifting, right? A lot of times people hear, oh, wow, I have osteopenia now. And okay, well, did you know that osteopenia is a metabolic condition that is very very connected with coronary artery disease. Do you have adequate amounts of calcium and vitamin K and magnesium and eating it in the right way for utilization and for your body to absorb and put it into the bone versus the heart muscle? Lots of things going on, but they also, if you follow a heart healthy diet that focuses on nutrient adequacy, getting all the nutrients your body needs in the right quantities and in the right pairings, you help address bone health, arterial health, cholesterol, body fat distribution, insulin resistance. It's all one unit and we're all connected. So I really recommend that you're looking at the whole picture of things and understanding how your body works. This is not a time to go on a very low calorie diet because then you become nutrient deficient, which can exacerbate and cause more issues from a heart health perspective. So hope that little brief introduction to importance of menopause, heart health, and science-based nutrition is helpful to you. Feel free to join my email list for more heart disease prevention tips, and make sure that if you are looking for more support, you check out Optimize on entirelynourished.com. Until next time, have a wonderful day.